This month, the CDC reduced the number of recommended vaccines for children following the Department of Health and Human Services approval under the Trump administration.
KXI 12's Olivia Thompson spoke with Sherman doctors about how families can make informed decisions moving forward.
Effective January 5th, the previous list of 17 childhood vaccine recommendations is now 11. The CDC says the change is to mimic other countries' standards. Sherman Medical Center's Dr. James Frame says the approach makes room for a healthier population.
We now see a change in the population, and we're trying to fine-tune our recommendations to say not everybody should get everything.
Dr. Frame says the one-size-fits-all vaccine approach is no longer applicable now that the population has proven to grow healthier and resistant to some diseases. The new schedule puts vaccines into 3 categories: recommended for all children, shared clinical decision-making, and high-risk groups only.
Choose with your physician who's at risk and who's not.
This year, 8 flu-related pediatric deaths were reported to the CDC, and influenza is among those vaccines moved to the shared clinical decision-making group. Dr. Frame says it's best to treat the CDC's recommendations as a mere roadmap.
Some patients may have a recommendation for all 17 vaccinations, whereas others who are at very low risk may only have a recommendation for 11 vaccinations. That's between the child, the parent, and the provider.
Pediatrician Dr. Joseph Lipscomb has worked in the Sherman community for 21 years. He took a break from a packed office to sit on the table himself with the message.
For a mother that is expecting or already has a family and feels concerned or confused about these new recommendations, what can you tell them?
I would tell our patients not to worry. They need to come talk to their physicians. The changes with the CDC recommendations have frustrated us a little bit because they come from a political stance and not as much science.
Frame adds, while it's tempting to search the web, your best move is to talk with your doctor.
We'd rather people not confuse their Google searches with our medical degrees.
Lipscomb fears that vaccine-preventable diseases will resurge if parents fear vaccines that have been proven safe and effective for decades.
I've had patients in my clinic in the last 4 months that are unvaccinated that have had vaccine-preventable conditions that I haven't seen in 15 years.
Don't accept the one-size-fits-all. It may not necessarily be the good thing.
In Sherman, Olivia Thompson, KXI 12.